All right, let's talk about mastering manual blood pressure. It's one of those skills that's just fundamental in healthcare. In this guide, we're going to walk through how to get it right every single time. You know, precision is everything with this. The little details we're about to cover, they can have a huge impact on a patient's diagnosis, their treatment, and their overall outcome. So yeah, getting this right isn't just important, it's absolutely critical. Okay, so let's get into Act 1, the setup. You have to remember that what happens before the cuff even touches the patient's arm is just as important as the measurement itself. This part really sets the stage for everything that follows. Now, these are your non-negotiables. We're talking hand hygiene, introducing yourself, confirming that patient ID with 2 different identifiers, and just briefly explaining what you're about to do. This isn't just a checklist, you know? This is how you build trust and make sure you're safe from the get-go. Every single one of these positioning steps is there for a reason, and it's all about preventing a falsely high reading. If their feet are dangling or crossed, if their arm isn't supported, or even if they're just chatting away, you can accidentally inflate their blood pressure reading. This calm, supported position is just essential for getting an accurate number. Oh, and using the wrong cuff size, it's probably one of the most common errors out there. If the cuff's too small, you'll get a reading that's too high. If it's too big, you'll get one that's too low. This table gives you the exact sizing to look for. Seriously, always take that extra second to make sure you've got the right tool for the job. All right, our prep is done. Let's move on to Act 2 and get into the action, the core of the procedure itself. You'll see how this builds directly on that careful setup we just did to get a really precise, reliable measurement. So, 1 inch. This little gap is a super critical landmark. You want the bottom edge of that cuff to be about 1 inch, or 2.5 centimeters, above the crease of the elbow. Why? Because it gives you the perfect amount of space to place your stethoscope bell right over the brachial artery without it bumping up against the cuff. Okay, this is the palpatory method, and whatever you do, don't skip it. By inflating the cuff while you're feeling for the radial pulse to disappear, you get a really solid estimate of the systolic pressure. This is so important because it helps you avoid something called the auscultatory gap, which is a weird temporary silence in the sounds that can trick you into getting a systolic pressure that's way too low. So that number you got when the pulse vanished, just add 30 to it. That's your new inflation target. This way, you make sure you inflate high enough to get a true reading without going overboard and making the patient uncomfortable. Now, with your stethoscope in place over the brachial artery, you can start to deflate the cuff, and this rate is absolutely vital. You want a slow, steady deflation. We're talking 2 to 3 millimeters of mercury per second. If you go any faster, you risk just blowing right past the real systolic and diastolic numbers, and the whole measurement is basically useless. And here it is. These are the 2 key moments you're listening for. That very first clear thump-thump sound you hear as the pressure drops, that's your systolic pressure. Then you keep listening as the sounds get softer, and the exact moment they vanish completely, that's your diastolic pressure. Getting the reading is obviously a huge part of the skill, but you're not done yet. Let's move on to Act 3, the resolution. A professional finish is what ensures patient safety and completes the whole cycle of care the right way. And this is just so important, but so easy to forget. Simply telling the patient their reading is a huge part of patient-centered care. It gives them information about their own body and keeps them involved in their own treatment. It's a small thing that means a lot. So once the patient knows their reading, you fully deflate and take off the cuff. These next steps are just core professional responsibilities. Wiping down your equipment is critical for infection control, and finishing with hand hygiene protects both you and the next patient you're going to see. Before you leave that room, every single time, you do a final safety scan. This quick 5-point check just makes sure the patient is left in a safe, comfortable position. It really needs to become second nature. And finally, documentation. You know the saying in healthcare, if you didn't document it, it didn't happen. Get those findings recorded accurately and right away. And always, always report any weird or concerning readings based on your facility's rules. So there you have it, a task that takes maybe 2 minutes, but one where mastering the details is everything. It's a pretty powerful reminder that in healthcare, it's the accuracy in these fundamental skills that has the biggest impact on our patients. That's really where excellent care begins.